It's my feel-good breakfast show.
As a parent, hearing your child cough is always a little bit concerning, especially when it's a deep barking cough that vibrates throughout the house. Kind of makes you feel like they're struggling to breathe. Now, this barking cough is also known as Croup, which is a viral infection of the vocal cords, to be specific. And we're about to chat to pediatrician Dr. Hanneke Haynes on what exactly is Croup, first of all, and what we can do to treat it. A very good morning, doctor. How are you?
Good morning. I'm very well, thank you very much, and you?
Surviving the flu season thus far, so
Touch hood.
doing well, yeah.
Yeah, no coughs this side, touch hood. But
Absolutely.
But, you know, a loud barking cough must be concerning for any parent, especially when you say they are struggling to breathe. What exactly is Croup, and is this something we generally find in only children?
Croup is a viral disease that basically causes inflammation of the airway just below the vocal cords. So there's some swelling and inflammation, which narrows the airways, and then they get this kind of barking cough. It almost sounds like a seal that's barking, and it's a tinny, very typical type of cough, and obviously that's very, very alarming. Now, it most commonly happens in children between 6 months and 3 years of age, usually during autumn or the early onset of winter, very more commonly than other times. But it can happen as young as 3 months up to 6 years. So it is very much a disease of children, and it's because they've got a very small airway.
Now, I've got to say, as I've experienced it, I've got a 3-year-old boy, and we've had to go rush through to the emergency room twice for what turned out to be Croup. I think it's terrifying when it seems like your child can't breathe, going along with that cough, as you say, with the airways being blocked. What are some of the symptoms that we should be looking out for as parents in our child?
Absolutely. So Croup is basically a disease. It starts off with a bit of a blocked nose or a bit of a ruddy nose, and then they develop fever. And within basically 12 to 48 hours, that barking type of cough starts appearing. And together with that, they also have got a hoarseness in their voice. And then they've got stridor. Now, stridor, I'm going to demonstrate to you. It sounds something like a wheeze, except it's usually during inspiration. So it goes...
Oh.
Okay, and that's one of your warning signs. So when you're not 100% sure when to go to the hospital, it's always a good idea to check with your doctor. But if it's a mild, kind of Croup, and they do not have stridor, they only have got that kind of barking cough, and they've got a mild fever, and they're still drinking quite well, then it's fine. We can treat baby at home. But as soon as you start hearing that stridor sound, that kind of sound, and especially if it's in and expiratory, that goes, then it's very important to go to the hospital. Also, when there's any other signs of respiratory distress, and that would be when you look at your child's chest and there's some recession, so the whole chest wall is moving in and out. If the baby becomes very distressed, and you can see he's agitated, he doesn't want to drink his fluids anymore, the temperature goes up and up and up, or the symptoms doesn't want to subside, that's all kind of signs that says, listen, this is time to go to the ER.
I pray this
My
never
heart is
happens.
going. I'm just
Yeah.
listening to you make that sound. It's taking me right back to that place. It is, for a parent, it is terrifying.
I would literally
Absolutely.
be out of my mind because it can be so stressful on any parent. But exactly how long can this last, doctor?
Well, the good news is it is a self-limiting disease. So we're looking at literally about 3 days. But within 3 days, that croupy cough should start subsiding. The other little symptoms, the symptoms of a bit of a runny nose and a blocked nose and a fever, that can carry on for about 7 days. But the cough definitely within 3 days should be gone.
Is it contagious? Is this something that's specifically for children? Can we, as other family members, adults, catch it? And is Croup contagious for other children? Can we allow them to go to creche, for instance?
Right. So basically, the virus that's causing the croup is something most commonly parainfluenza virus, but it can be some of the other viruses as well. So the virus is contagious, but the disease is not. So in one child it can give croup, in another child it can give a sore throat, and another one just a cold, and another one bronchiolitis. So the virus is contagious, but the disease is not.
Okay.
So one Croup child won't necessarily give another child Croup, but it can give other kind of respiratory symptoms. So yes, definitely keep your child at home. Not a great idea to take them out.
I was going to say, don't you
with other
dare
children.
put your sick child in creche. I say that to all parents out there.
Lastly, maybe, Doctor, let's discuss treatment. How can we then treat Croup?
If your child has got mild Croup, so basically just that little bit of a cough, but not really stridor, there's a couple of wonderful things you can do at home. And the one is steaming. So kind of close the bathroom door, put the shower on heat, and let that steam fill the bathroom. And sit with your child and play with them in the bathroom, that they can inhale that nice and warm steam. That definitely helps with swelling. Yeah. And the other little thing, this is very interesting, the boerenrate, as they used to say, was to give a child a stiff cup of very hot, warm black coffee, and then take the child out in the cold night air. And that definitely did work. And that's for two reasons. The one reason is that coffee has got caffeine, and that stimulates breathing. But cold night air also helps to reduce the swelling of that narrow airway. So I wouldn't recommend the coffee. You're going to be up for the rest of the night. But interesting enough, cold night air can definitely be one of the treatments that you can do. And that's why parents often come to the ER and, the stridor is gone. And it's just because they had to go out at nighttime. So that's a couple of things that you can do. But remember, as soon as you hear that stridor, that sound, rather take your child in.
Sure.
I wouldn't play around with that.
I mean, you don't need much motivation. Trust me, as having experienced that, as soon as you hear your child wheezing like that, and then, of course, when you haven't slept the whole night because you've been freaking out, you can have the cup of coffee in the morning to wake yourself up. But, Doctor, thank you.
Absolutely.
Thank you so much. That really has helped us, I think, wrap our minds around what Croup is and how we can treat it. But thank you so much. Stay safe out there and stay healthy during the flu season.
Thank you very much. I really appreciate it. Have a good time.
Now, with a range of coughs out there, it's important as parents we know exactly what we are dealing with and how to best go about treating it. Now, DILINCT Junior is specially formulated for alleviating wet coughs in young children. It's tartrazine and alcohol-free and recommended for children 2 years and older.
DILINCT Junior clears a wet cough and thins and loosens chest mucus, suitable for children from the age of 2 years.